Hello guys, my name is Arthur Parks and welcome to my channel. For today's video, pag-uusapan natin yung my 1-year anniversary working as an emergency room nurse. So as of June 15, I turned 1 year. I've been working as an ER nurse here in Indiana. So we'll just go ahead and have a casual conversation like, where am I right now? How do I feel going to work? What are the skills that I developed? And what's the next chapter? Am I gonna continue working as an ER nurse? Am I gonna change my specialty? Am I gonna quit doing nursing? So just sit back, relax, and enjoy this. So it has been a roller coaster kind of thing working in the emergency room. As you know, or sa mga hindi nakakaalam, I started in the emergency room with no hospital experience. I graduated 2006. I worked in the intensive care unit, like technically a training for like, I don't know, 6 or 7 months, and then didn't really practice my profession for almost 12 years. So it's kind of rough when I went back because I don't know anything. I don't even know how to start an IV. I just don't know how to become a nurse. So yung leap talaga na tinalon ko is medyo mataas because I know that this is gonna be critical. I need to learn fast. I need to be assertive. I need to learn the language, learn to communicate well, need to communicate to the patient, communicate to the doctor, etc., etc. So it's a roller coaster ride. Every day I'm still learning, of course. As a nurse, you learn every day, especially in the emergency room because there's no same shift, technically. You don't know kung ano yung mararanasan mo, kung ano yung may encounter mo for this shift. So I'm enjoying it. I'm really enjoying every shift that I'm working with. Sabi nga nila guys, there's no same shift when you're working in the emergency room. It's the same like disease process that you see, but it's a different approach because you will know if this person is going to react to this, pwedeng, you know, iba yung attitude ng patient mo. So it's kind of different. You will see a lot of diversity working in the emergency room. You will practice your critical skills. You will learn like the triage, which is very unique for an emergency room nurse. So let's go ahead and talk about the skills that I've developed. First, I got way better on my IV skills. I can go ahead and start a line comfortably. Some nurses will ask for my help starting an IV, especially pag hindi nila nakuha. So that's one thing that I'm really getting good at. Another skill is triage, like knowing who is sick, learn on how to categorize them based dun sa triage, or if they're gonna be 1, 2, 3, 4, 5, yung ganun. So I can see immediately if this is like a sick person or pwedeng hindi naman talaga may sakit at gusto lang ng pain medicine or something like that. But yeah, I got better with that. Reports, like giving report to someone else, accepting the report from the EMS or from another nurse. I'm still working on it. I'm not as good as other nurses when it comes to giving report, and I think that's one of my opportunity that I'm really trying to improve on. Part of it is because English is my second language, but as much as possible, I'm really trying to give accurate report, everything that happened during my part of care, the report that was handed over to me by the EMS or even the previous nurse. I'm really trying to paint the picture towards the next nurse. Parang ganun. Of course, yung sa mga knowing, just basically knowing on what to do, like what if the patient comes in having a stroke-like symptoms, ano yung mga dapat mong itanong. Patient coming in having a heart attack, chest pain, like lacerations, protocols for abdominal pain, sepsis, being comfortable in giving out different drugs that you know that you're not gonna harm your patient, multitasking to prioritization, kung sino yung mauuna when it comes to your care. So those were things that I'm getting good at and making sure na nadi-develop ko pa yun. I also developed the appreciation on different floors. Like, as an ER nurse, you do things differently kaysa pag sa med-surg ka or ICU. And now that I see like different types of care, it's different. Like, say for example, I can't function as a med-surg nurse. Hindi ko kakayanin yun, guys, na you only have like, you have 4 patients or 5 patients and you're going to spend the 12 hours with the same person. I mean, yeah, medyo mahirap talaga, kaya saludo ako sa mga med-surg nurses natin. In the emergency room, it's kind of different. Normally, the patient's gonna last sa care mo, normally 3 hours. In an average, 3 hours. Minsan 3 hours na sa'yo na lahat ng lab, so you know if you're going to admit them, or if you're going to discharge, if you're going to transfer. But it can get really crazy. Like, you may have like four non-critical patient, but if another patient comes in, pwedeng magbago ka agad yun. Like, especially with the coronavirus and stuff, we've seen patients like walking, akala mo parang ina-asthma lang, but when you check their stats, they're literally dying and you need to do an intubation. You may, say for example, got someone from the front door, gunshot wound, overdose. So, dapat parating alert na you'll never know what you'll get. I mean, you can't get really comfortable in the emergency room. Dapat you have a little bit of anxiety in order for you to make that quick decision, critical thinking na ganito yung dapat gawin. And it's not something that you will develop just by reading. You really need to experience it. Like an IV. You can read a lot of stuff about starting an IV, but kailangan mo talagang maramdaman kung paano mag-start ng IV para talaga matuto ka. Same thing with intubation. Like, you just need to get used to like people crashing para alam mo kung ito yung dapat gawin, ito yung anticipate mo na hingin ng doktor. Being comfortable with giving drugs like etomidate, succinylcholine, propofol, yung mga drips and all, Levophed, dopamine, dobutamine, and such. Kasi I didn't really get comfortable on giving those until I hit my 8 months. I can go ahead and take care of like level 3 or level 2 patients na medyo somewhat stable, but now I'm not saying that I'm gonna do it on my own, but I can go ahead and accept like patient who is unconscious, patient that's intubated, na may mga iba-ibang drips. So I got really comfortable in handling those. Coworkers. Yeah. So working in the ER, of course, meron kang mga coworkers, and sometimes there's a lot of drama involved, like night shift nurses versus day shift nurses with the management and stuff like that. So ako naman kasi yung tipo ng tao na pasok dito, labas dito, and then as long as you're not crossing me, then we're good. Parang ganun lang. So that's something that's it's always part of like work na may mga workplace politics, so you really need to learn how to play with that. And I also appreciate that I'm transitioning from being a follower who will just go ahead and check the orders like this, I need to do this, I need to do that. like waiting for the doctor's order before you will go ahead and take actions on it. Now I'm in the position that I'm still waiting for their orders, of course, but you anticipate, like you ask questions already, like, can we do this? Can we do that? Can we give this? Can we give that? So medyo mas nagiging confident na ako when it comes to like knowing to protect my patient, knowing on what my patient needs. Like, say for example, may mga ibang matatanda, especially if they have dementia, that I really can't tell that they're in pain. They will not verbally like tell it to you guys na I'm having pain and I need some pain medicine. So it's your call. Dapat nakikita mo yung signs if they're really comfortable or not. Especially when it comes to drips as well. Like, titrate yung mga drips, kung kailan mo i-increase, kailan mo i-decrease. Decisions that can really affect the care of your patient. You also need to work really fast. As much as possible, you want to clear the emergency room. That's the ideal thing. You want to transfer them, to send them home, or to admit them. Yun yung papel ng ER nurse. As much as possible, dapat walang nag-aantay sa emergency room. I also learned that even if you're working for like 1 year, 2 years, 3 years, 4 years, you always ask questions. If you're not 110% sure of what you're doing, just ask questions from someone, from the doctor, o kaya sa mas tenured na nurse. It wouldn't hurt. Hindi mo mararamdaman na you're stupid when you're working in the emergency room because they will always provide you that information. They will always like, you know, just a second eye sa mga bagay. Kahit ako ngayon na tipong, I think something is not right. Can you go ahead and check this with me? I mean, as long as they're not like drowning and, you know, merong time sila, then they will help. They will always help. Just get that second opinion, like, can you go ahead and just confirm that this is the right medicine that I'm giving, that this is the right amount? How do I do this? Am I doing it right? The way on how I do it is, this is how I'm doing it. Are you doing it the same thing? So ganun yung approach ko parati. Ipapakita ko na ganito ko siya ginagawa, ganito ba yung dapat na procedure, ganito mo ba siya dapat gawin. And always extend help. I guess that's why a lot of my coworkers love to work with me because I always extend that extra hand. If say for example, if all of my patients are okay and I'm just technically doing like documentation or something, and I notice that there's an ambulance coming in and I know that it's the other nurse who's getting the ambulance, I will go ahead and like go in, help with starting EKG, starting a line if that patient doesn't have a line, making sure that take the vitals and stuff, yung mga ganong mga basic na kailangan gawin, just to make it easy for the second nurse. Kasi, especially when you work at nights, normally it's after 3 p.m. or I'm sorry, after 3 a.m. there's only 2 nurses working from 3 to 7. So dalawa lang talaga kayo na magtutulungan, and as much as possible dapat mabilis yung magawa yan para in case na pag may dumating ulit, pag dumama yung pasyente, free kayo. So you develop a certain kind of trust on your fellow night nurses because it's just you guys. Talagang kayo lang magpapatakbo ng ER kasama ng doktor, kasama ng clerk ninyo. But unlike days that they have a lot of staff, at nights you guys are on your own. So what's next? I'm so happy that at this point I'm still enjoying what I'm doing. Medyo maraming pinagdaanan within the past few weeks and months, especially with the coronavirus. Going into work, there's no certainty that you're not gonna get sick and stuff, but you just need to protect yourself. And I still see myself doing this for a long time. I enjoy what I'm doing. I love helping people. I love critical thinking. I love decision making, stuff like that. I may do nurse practitioner in the future, specializing in emergency medicine. Bala ko rin na mag-travel nurse now that Indiana is being part of the compact state. so I can go ahead and practice on like Florida, different states na kasama nun. So pwede ka na rin mag-practice nun. I'm also thinking about joining Air Force as an Air Force nurse. That's an option na hindi ko talaga in-accommodate before. Pero now I'm seeing a lot of like positive na pwedeng mangyari sa akin. I'm not really gonna do it for like long time, but it's kind of good for you to have like an experience in the military, especially if it's Air Force. Or pwede rin naman na magstay lang ako dito sa hospital, gain more experience, because again, 1 year, it's not enough. You're at that point that you're comfortable, but you still are learning a lot. So and lastly, I just want to share this. I heard it, or I watched it from Holly. She is also a registered nurse. Bago lang din siyang nurse, and she said, it doesn't get easier, but you get better, which is so true when it comes to our profession, because you will go ahead and encounter a lot, but you will start to develop that confidence that you know what you're doing, but not too confident enough that you're not going to ask questions. So, again guys, sa mga nagsisimula pa lang dyan ng mga nurses, I guarantee you 100% it will get better. Looking at myself like a year ago, na going to work, it's like going to hell, that I don't know what I'm doing, I don't know anything at all. So just be kind to yourself. Do not overthink anything. Learn to accept that awesomeness. It takes time. Hindi ka gagaling ng isang linggo, ng 2 linggo, ng 3 linggo, ng 4 na linggo. You really need to go through with the 1 year para masabi mo talaga sa sarili mo na, nandun na ako sa sitwasyon, nandun na ako sa point now that I can do this, I can do that, and you will appreciate going to work. So, just hang in there. Alam niyo yun, just trust the process. As long as you guys are asking for help, asking questions, huwag magdunong-dunungan, always prioritize, airway, breathing, circulation, stuff like that. And if you need help, just yell, ask help. So thank you guys for watching. I'll go ahead and do another video. This time I'm gonna show you guys my apartment, give you like paano makakuha ng apartment here in Indiana, how much it costs, and anong itsura ng regular apartment here. So please subscribe to my channel and see you in the next video. Bye!